Afternoon, everybody.
Yeah.
Thank you all for coming. I'm Dr. Levi Funches. This is Dr. Belvin Miller. We're here with not one more, basically to talk about an important issue today. We're going to talk about something that's affecting our community, but our country, maternal mortality. And this is a conversation to have in the community, especially for communities of color, because when we see maternal mortality, which if people are not familiar, that's basically a mother dying during childbirth or between 42 days or a year after birth, or dying from complications from it or just during that time frame. And when you look at other countries, the U.S. is kind of, when we compare to other wealthy countries, we're actually have one of the worst rates, if not the worst rate, amongst wealthy countries. And so this is why this is an important issue. We lose about 600 women a year to this. And that's not, and then when you look at the numbers for Black and brown mothers, the numbers are even worse. And so we want to talk about this issue because it's an important issue. Because I think, losing a life is sad and unfortunate and just a bad thing just of itself. But when you think about it, it also leaves a void in that family that mother's gone, the effect that has on the partner and the child. And that's why we want to have these conversations. And in particular, we're trying to engage with men about this issue because, this is a conversation for the entire community. We want to talk with fathers about things to notice what this issue is, making them aware of it. And so we have a good amount of speakers today. We have 2 sessions. This is the first one, and the next session will be next week. So today we'll have someone, we're going to talk about what maternal mortality is. We then will have someone come and talk with you about pregnancy and how to address with Dr. Sanders here. He's going to speak on that. We then have speakers who are going to talk about about how to communicate and be effective and be an advocate for this when you might be in 2 separate households, being an advocate for your child when the mom and dad may be in 2 separate homes. And then more importantly, I think it's something that I think is very important because me being a healthcare provider, I always want to empower my patients. I think a lot of times, sometimes patients feel that they can't question, or if there's something that they hear or feel, and maybe the doctor's not picking up or attuned to it because we're human, we're not perfect, that they feel that they can't question the doctor. We want to talk about that, like saying, yes, you can, and give tools about how to talk about that. So we'll talk about patient advocacy today. And so it's going to be a good session, I think very informative and pertinent for this important issue because we need to make it better for all women in our country. So I'll leave that. I'll hand off to Dr. Miller, I think, who's next on the program to come up and talk about maternal mortality.
It may not be apparent in the taping, but Dr. Funches is very tall. I'm sort of short. My name is Velvet Miller, and I am the director of the Not One More project. I'll give you a little background on what that is. It's a project that started a few years ago with the question of, we do a lot for infants, and we pay a lot of attention on infant mortality. And the good news is infant mortality has decreased significantly for all populations. What we don't pay attention to as much is what happens to the mothers. And yes, there are many mothers that have successfully birthed and moved on in their lives, and there are some that die. What raised my particular concern was the disproportionate number of Black women that died. So I'm trying to think through, what does that mean? And the more I looked, the more I studied, the more I learned that it's about 3 to 4 times the rate of Black deaths to white deaths. The death of a mother, as Dr. Funches said, leaves a major void, and the death of any mother during childbirth is a sad thing. It's very unfortunate. When you look at the disproportionate number for Black women, it raised the question of what can we do about it or what is being done about it. And while there are lots of initiatives around that have focused on maternal health, there's not as many that have focused on maternal mortality and what can be done about it. So yes, it's a problem, and it is a problem in the country. These numbers of disproportionate deaths are consistent in every part of our country, the United States. And what we know is that in Indiana, the latest, I just learned this a few minutes ago, we had been 47th in terms of worst outcomes for maternal mortality. The latest that my colleagues just told me about is we're now 48. We're not doing well. We're getting worse in Indiana. What we also know is that in terms of maternal mortality, 60% of those deaths are preventable. That's a fact. Unfortunately, in Indiana, it's about 82% are preventable. So here in Indiana, we have a challenge, a major challenge, and particularly so for dealing with Black or African American women. So the issue is, what can we do? Or let's go back a minute. What are the causes of these deaths? How come these women are dying consistently across all populations? All populations. Women die of hemorrhage, during the delivery, post-delivery. They die of infections. Well, how does that happen? Well, we have a high number of cesarean births in this country, higher than other countries. What we also know is that we have an exceptionally high number of Black women that have cesarean sections. That's an operation that's opening the body. It is exposing the body to other pathogens and potential infection. So hemorrhaging or bleeding heavily, infections, embolus or thrombus, what happens? That's, if you think of Serena Williams, the story of Serena and her concern because she had deep vein thrombosis, meaning right in her lower limbs, she had potential of an embolus or blood clot circulating to her lungs and heart. Well, in the challenge of her birth of her daughter, she raised the question of something's not right with my body. And unfortunately, she was dismissed and ignored. Fortunately, she, with all of her inner strength, said there's something wrong and I'm going to find somebody who's going to help me. Another cause is what I'm showing is that an embolus can occur and cause a death. There are many causes, cardiac problems, blood pressure problems across the board. These are challenges and causes of death for women during their maternal journey. So what's the big deal and how come Black women have still a higher rate? Well, what we know is that no matter where you live, how much money you earn, what your educational level is, where you work, you name it, any of those key factors that we call demographic factors, when you hold them constant, when you say, this is the same for everybody, there are two things that make a difference for Black women. Just two, maybe more, but just two that I would share with you. One is a condition known as weathering. Weathering. This is an experience that Black folk have every day. And if you're from the country or the old South or whatever you say, well, I'm just weathering right along, is a phrase that may have been heard. It means handling what you perceive, experience on a daily basis that reminds you of your color, that you're Black. It reminds you of the systemic racism that is around the country. So each day, we experience something that causes us to weather right along. What that means also is that it affects our bodies. And when you are constantly exposed and coping with that kind of racist, I'm just saying it right out loud, racist exposure, it affects your body neurologically and physiologically. It exposes us, therefore, to a higher rate of chronic disease and illness. What that means for Black women is that they weather a lot every day, as men do, Black men do, but it has a particularly harmful effect on pregnancy. That's one. So that's what's different about Black women and pregnancy. We are weathering a lot. The second is to acknowledge, say it out loud, that we are exposed to systemic, direct, blatant, and implicit bias. Now, that means some of the systems that we go to during our course of motherhood journey don't hear us, don't receive us, don't listen to us as they didn't to Serena about our conditions. It's a legend that Black women tolerate pain much more than anybody else. It's not, no, it's not. But so Denise may have had pain post-delivery of my grandson, Booker, but she wasn't always heard when she said, I'm in pain. She wasn't always attended to when she said, I hurt. So we are exposed to, and Black women, when they're pregnant, are exposed to a system that is not always responsive because of its bias or racist structure. It's a systemic structure in healthcare, systemic structure that are racist in where we live, throughout what we expose to as Black people. So there are two things. One, let me just reemphasize this. Black women are dying at a higher rate than anybody else, 3 to 4 times. They're dying of the same causes, medical causes, that others are dying. But the difference that we know are two major factors. The impact of weathering on the body, and the fact that we are functioning in a system that is racist. So the Not One More Project is committed and said, let us find what we need to do and can do to promote maternal health and do what we can to reduce or prevent maternal mortality. And since 80-some% in Indiana, 80% of those deaths are preventable, there are little things we can do that can make a difference. So I'm going to close this component with that favorite quote from Angela Davis. I no longer accept the things I cannot change. I will change the things I no longer accept. So I'd like to welcome you to this session, the first of our fatherhood series. We will have another next week. And just to restate what Dr. Funches said, a key element in keeping our pregnant woman healthy is to have involved partners, involved fathers throughout the pregnancy, delivery, certainly that first year, but hopefully throughout the life of the children. The role of the father is so poignant, it's so important. It's why we're having this series today. And there's data that says it reduces the risk of complications significantly. So I'd like to welcome all fathers, all uncles, or cousins, or brothers who can play a significant role in assuring and promoting maternal health and helping us diminish maternal mortality.